Good morning, everyone. I'm Olivia Nakisita from Makerere University School of Public Health, and I'm going to take you through a sub-study in a wider study on maternal health services for adolescent urban refugees that focused on utilization of antenatal care services and the associated factors among urban adolescent refugees in Kampala, Uganda. Uganda hosts an estimated 1.5 million refugees, and 12.5 of these live in urban areas and especially in Kampala. Uganda is implementing an integrated healthcare system in which both refugees and host populations utilize the same services, healthcare services without discrimination. And this study was to assess the level of utilization of antenatal care services and associated factors, because since it's integrated, there is no clear-cut data system that captures refugees and the host population. And this study was very necessary. It was a cross-sectional study that was conducted in Kampala City, and we interviewed 637 urban refugees who were mothers who got pregnant between the age of 10 to 19 years, and we considered 5 years from the time of the study backwards. They were systematically sampled, and the interviews were conducted in ODK, and the data was exported in Excel, and analysis was done with Stata version 17. We carried out univariate and bivariate and multivariate analysis, and we reported with proportions, p-values, odds ratios, and confidence intervals. We found that most adolescents, 92.6 of them, attended at least one antenatal care service, which was a good finding. However, only 71.8% attended between 4 to 8 times, 4 and above. But then when it came to the recommended WHO 8 visits, only 11.5 were able to attend the 8 visits. And then fewer than half of the respondents, 41%, were able to attend antenatal care within the first trimester, which are 12 weeks of the pregnancy. And the factors that were associated with antenatal care utilization were being married, and yet we know adolescents are not supposed to be married, and living in an extended family. The factors that were associated with attending ANC antenatal care during the first trimester were also being married, having an education, and the period one had lived in the area. In conclusion, utilization of antenatal care by adolescent urban refugees is suboptimal. They are utilizing, but not optimally. And just 1 in 10 of the girls are attending the recommended 8 visits by WHO, and less than half attending their initial ANC visit within the first trimester. And there is need for targeted interventions to encourage adolescent refugee mothers to utilize antenatal care services optimally. Adolescents, when they get pregnant, they do not reveal or talk about their pregnancy early. So it affects how they attend ANC, and therefore we need to target them. We need to tell them that in case you're pregnant, if you can't tell your parents, maybe you go to the health facility, because Kampala has a good network of public facilities, and this study found that actually around 83 of them were utilizing public health care from the public facilities that are free. Thank you.